Hello, welcome to today's video. I am Dr.Thejas, ENT surgeon based out of Hyderabad. Our discussion for today is about nosebleeds, which is also called as epistaxis in the medical terminology. Before we delve into the depths of nosebleeds, let us broadly classify it into a few groups for better understanding. The first group is the pediatric age group in children. The second group is the age group of middle-aged people. Third is the geriatric age group in older people. In pediatric age group, the most common cause of epistaxis is fingernail trauma. Usually a kid tries to touch the nose, because of which there is nasal bleeding. This bleeding is usually from the front of the nose and it does not go to the throat. The second group, in the middle-aged people, the most common cause of nasal bleed is hypertension or trauma. In hypertension, whether the person has a previous history of hypertension or not, when the BP shoots up at some point of time, there is bleeding from the nose, which is a sort of corrective mechanism to reduce the blood pressure, which the body does for itself. In the geriatric age group, the most common cause of nasal bleeding is trauma. An old age person, trauma to the nose or trauma to the face is very common, whether they are at home or they are outside. In all these cases of nasal bleed or epistaxis, bleeding will usually spontaneously stop by itself unless and until the patient has an underlying blood condition. Now, what can we do when there is epistaxis at home? The first thing which we need to do is to put the head down and pinch the nose by giving adequate pressure, and also put an ice pack over the nose to prevent further bleeding. If the bleeding does not stop even with this, a small piece of cotton can be taken and plugged into the nasal cavity, with which the bleeding will stop for sure. It is not a highly critical situation where a person needs to be worried. This precaution can be taken at home and the patient can then be taken to your nearest ENT doctor. Thank you.